stick around because we also want to bring in Dr. Arthur Caplan of NYU Langone Health. And Dr. Caplan, it's great to have you on Yahoo Finance. Let's just start with this debate whether or not the CDC should reinstate the mask mandate. Of course, going off of what Ant was just saying, a lot of this has to do with the fact that we're seeing the rise of the Delta variant here in the U.S. What's your position on this? Do you think the mask mandate should be reinstated?
Well, the bad news is the Delta variant is highly contagious. The good news is it doesn't seem to be worse in terms of causing death or hospitalization. So it really spreads and moves in unvaccinated parts of the country. I strongly favor a mask mandate for all healthcare institutions. Those nurses are right. They shouldn't be working in environments where they're more likely to encounter COVID from patients, and they're more likely to infect patients that they might come in contact with because they're there with cancer or immune diseases or after a transplant, or maybe children who can't be vaccinated. So for sure, partial mask mandate in the healthcare workforce. General for the entire population, there are some parts of the country that really ought to be doing that. You look at vaccination rates, 35% Arkansas, 34%, I think it is Missouri, outbreaks all over the place. They've got to take some steps to get that under control.
Dr. Caplan, Anjali here. Let's pivot a little to something else that's going on today, which is talking about really the misinformation that we've seen throughout this pandemic. I want to play a soundbite for you from the American Public Health Association's director, speaking about what you and I have talked about before, which is the loss of knowledge of the scientific method in this day and age. Take a listen.
Most people in most communities, until they discovered Tony Fauci, could not name a single living scientist. And particularly the fact that the scientific method is one where someone has an idea, they test it, they find all the things that don't work. That's good science, but they also find out what does work. Then they publish it, sometimes the good stuff that works, sometimes the stuff that doesn't work. And then that is tested by other people, and that it's an iterative process until we get to what we believe is a preponderance of an understanding, which we then call facts.
So going off of that, you know, the steps to get to what we know are facts of the virus. We're still in a learning phase of this virus. And I know that the Surgeon General is well out today with, guidance on that. What are we looking at in terms of, what are your thoughts on really that thought process on just how America has handled the scientific method in the past year?
Poorly, very poorly. So social media has overwhelmed the old way of getting information out, which was scientists at a press conference, people issuing press releases, specialized reporters transmitting that information into the mainstream. If people were to be asked today who their scientist experts are, I think they might start talking about Fox News or a celebrity, someone who's prominent in the anti-vax movement, because they see them a lot on social media outside the mainstream media. Science has to do better in terms of getting its voice heard. It's got to have more spokespeople out on the social media side, and we have to call out false information. Most of what I see, say on Fox Opinion, is just wrong. Beating up on vaccines, casting doubt over their safety. It's not accurate, and we've got to say so.
And I know that you and I have talked about the anti-vaxxers and that movement and how much it's picked up. You, among other experts like Dr. Peter Hotez, have also been calling this out repeatedly. One of the things specifically that they've captured is the fact that former FDA Commissioner Dr. Scott Gottlieb is on the board of Pfizer and using that as a way to convince people. How does that damage sort of the messaging here?
Well, all anti-vaxxers are on the lookout for anything that can compromise the credibility of people who speak for science. Their biggest target is pharma, their second biggest target is biotech, and they're suggesting all the time that they're buying influence to promote vaccines. Look, nothing could be further from the truth. You don't have to buy influence to promote vaccines. You just have to look at the morgue, and you have to look, if you will, in the ICUs, and then see what happens when you vaccinate. So when spokespeople, whether it's Gottlieb or somebody else, have connections to companies, they have to be transparent. They have to say so. It may be better in some issues to just keep them out of it. Say the booster question, where Pfizer had a big stake. generally speaking, you can't open yourself up to attack as someone who's conflicted or someone who's got a financial stake in the game. That's just an anti-vax trope that they love to hit again and again and again. I don't think there's anything to it, but boy, psychologically, emotionally, they really use it, and the public starts to believe maybe this is just some kind of a gigantic plot to get us all to spend money on vaccines.
Doctor, for the vaccinated, what do we see in the breakthrough cases? Are they winding up in the hospital? And what are the symptoms of COVID, whether it's that variant, the Delta variant, or any other, if you're vaccinated and you have a breakthrough case?
So breakthrough cases are to be expected. Remember, vaccines are only 95% effective. That's great. We rarely see anything close to that for things like measles or the flu. This is incredible, but it does mean that you still could get infected. That's the bad news. Good news, the vaccinated don't wind up in the hospital. The vaccinated don't die. 99% of the deaths in the U.S. past couple of weeks, they're unvaccinated people. So it's important to pay attention to where it seems like people who've been vaccinated maybe got sick. They may have weak immune systems. Others who've been vaccinated, unfortunately, the protection didn't stick. But generally speaking, new variants aren't making us sicker. New variants aren't making us die more. They're just more common because they're spreading fast. We think like the vaccination challenge is over. It isn't. We are far from, I'd say we're at halftime in trying to win this game. We've got to keep pushing to make sure that we get much more vaccination done. That's our best defense.
And Dr. Caplan, I know that just focusing on getting the vaccinations done is round one, but round two is already up for discussion. The CDC advisory panel next week looking to discuss boosters for the immunocompromised. We know they're doing that in Israel right now. What are your thoughts on where this might go?
I think there is an argument, Ange, by the way, right away, to think about people post-transplant, immune diseases. Maybe they do need that third shot to get a booster. We've had some of that go on at my own institution at NYU with transplant recipients. But I don't think it's a major drain on vaccine resources. We're not ready to say everybody go out there and get a booster. Still not sure how long the vaccine efficacy lasts, so we need more information on that. I'm not panicked about that yet, but it will become a major issue. Here's the trade-off. If we need boosters, say in another 6 months or a year, with a lot of the world unvaccinated, what's America, let's say, their best defense? Is it to vaccinate ourselves with boosters to protect against new strains, or finally move big supplies overseas and stop the new strains from originating? It's going to be both a political issue as well as a scientific issue.
Dr. Arthur Caplan, thanks so much for taking the time to join us, and our thanks to Anjali Kamlani as well.